Hi students, let's see today's case. A gardener cut his left ring finger by a sharp edge of broken glass while digging soil. You can see in this picture, this is the left hand of the gardener, and you can also see a ring finger which is cut by the broken glass. So after the cutting, 3-4 days, a gardener developed a fever and his entire ring finger was swollen and painful. You can observe the case on this picture. So let's see what type of question can be asked on this case. A first question can be asked on this case is which structure in the ring finger that is likely to be inflamed in this condition. The second, what is the inflammatory condition called as? Which tubular structure protects the digital synovial sheath? The fourth one is name the Palmar spaces and write a boundaries of intermediate compartment of Palmar spaces. Name the canals that connects the Palmar spaces to the web spaces. And what is the surgical importance of these canals? So let's solve this case. So you can see in this picture, this is the hand and the green you can see this is the synovial sheath which covers the flexor digitorum superficialis and flexor digitorum profundus tendon. So in this case, a synovial sheath around the flexor tendon is damaged, and this case, this is the common synovial sheath which is also called as the ulnar bursa, and you can see this is the tendon which is covered by the again synovial sheath, and this is commonly called as a radial bursa. And when the broken glass cut the ring finger, the inflammation of synovial sheath can be occur, and this condition is called as a Tenosynovitis. So this is about the condition. The tenosynovitis of the little finger can also infect the ulnar bursa, which is a common synovial sheath. You can see over here, this sheath covers the tendons. As you know, the sheath having two layers, the inner is a digital synovial sheath and outer is made up of fibrous digital sheath. So this synovial sheath covered by or it protected by a fibrous digital sheath. And this is the tubular structure which protects the synovial sheath, and you can see over here this is the common sheath which is called as a ulnar bursa. There are 5 palmar spaces. You can see in the hand or in the palm A space in the mid region of the palm is called as a mid-palmar space, which extends till the flexor retinaculum. The space present at the thenar region or at the side of the thumb, it is called as a thenar space. Then what is west space? A west space is a area between the two fingers. That means in between thumb and the index finger, in between the index finger and the middle finger, then the in between middle finger and the ring finger, and the space between the ring finger and the little finger. So this is the subcutaneous spaces between the fingers, and that space is called as a web space. Then the pulse space is located at the tip of the fingers. So this is pulse spaces, and the space of Parona is located in the forearm. Let's see boundaries of mid-palmar space. We will see the boundaries anteriorly from superficial to deep. If you have learned or you have studied the palm, you should know the most superficial structure present in the palm is a palmar aponeurosis, which protects all the deeper structures. So, most superficial is a palmar aponeurosis. Then the superficial palmar arch. Deep to that, a flexor tendons of the medial 3 digits covered with the common synovial sheath, which is called as a ulnar bursa, and medial 3 lumbrical muscles. This lies anterior to mid-palmar space. Posteriorly, there is a deep fascia covering the third and fourth interossei muscle and the metacarpal bones. Medially, there is a medial palmar septum, and laterally a mid-palmar space is bounded by intermediate mid-palmar septum. Proximally means towards the forearm, there is a space extend up to the level of distal margin of the flexor retinaculum. Then distally, that means towards the finger, it extends up to the distal palmar crest, beyond which it communicates with the fourth and the third lumbrical canals. Let's see these boundaries on the diagram. So yes, as we have seen, you can see this is the section of the rest. So this is the anterior region. You can see this is the mid-palmar space and this is the thenar space. In the hand also, you can see over here the mid-palmar space located mid of the palm and thenar space at the thenar region or the thumb region. So let's see, as we have seen or we have learned the boundaries, let's see it in the diagram. Anteriorly, there is a palmar aponeurosis. Then there will be the superficial palmar arch. Then this structure you can see over here, these are the nothing but a flexor tendons of the medial 3 digits, which is covered by the common synovial sheath and medial 3 lumbricals. Posteriorly, it is covered by the deep fascia and the third and the fourth interossei and the metacarpal bones, and the third, fourth and the fifth metacarpal bones. Medially, it is bounded by the medial palmar septum, and laterally it is bounded by the intermediate palmar septum. Proximally, it extends to the distal margin of the flexor retinaculum, and distally, that means towards the digits at the level of the distal palmar crest. So this is about the mid-palmar space. We have seen on this diagram a boundaries of the mid-palmar space. You can see over here. This is the mid-palmar space region and this is the boundary. This is anterior one. This is posterior one. This is lateral boundary and this is medial boundary. So let's see a boundaries of the Thenar space. Yes, as we have seen, Thenar space located in the Thenar region. So again, anteriorly, a palmar aponeurosis, flexor tendon of the index finger and the flexor pollicis longus, which is covered by the synovial sheath and commonly called as the radial bursa, and the first lumbrical. Then posteriorly it is covered by the deep layer of the deep fascia which covers the adductor pollicis muscle. Medially it is bounded by intermediate palmar septum and laterally it is bounded by the lateral palmar septum. Proximally, again towards the forearm, extend up to the distal margin of the flexor retinaculum, and distally means towards the finger, it extends up to the distal palmar space or the distal palmar crest. So this is about the mid-palmar and the Thenar space. Commonly anterior boundary, posterior boundary, lateral boundary and the medial boundary. So this is all just we have seen on the diagram. Let's see again so you can remember each of the structure. Anteriorly palmar aponeurosis, superficial palmar arch, flexor tendon of the index finger which is covered by the synovial sheath, that is called as a radial bursa, and first lumbrical muscles. This is the anterior boundary of the Thenar space. Posteriorly, deep layer of the deep fascia which covers the adductor pollicis muscle. Medially, intermediate mid-palmar septum. Laterally, lateral palmar septum. Proximally, the Thenar space extends up to the distal margin of the flexor retinaculum, and distally it extends up to the level of the distal palmar crest. Now you can see in this picture, this is the mid-palmar space and this is the Thenar space. And these spaces connect to the web spaces through the lumbrical canals. You can see these are the lumbrical canals. So what is this lumbrical canal? The lumbrical canals are the spaces around the lumbrical muscles. This lumbrical canal has a surgical importance. When there is a collection of spurs in the thenar or the mid-palmar space, This pus drains through the lumbrical canals. When there is a collection of the pus in the thenar or the midpalmar space, it is called as a pus tank. And this pus is drained through a lumbrical canal. That's why this lumbrical canal is called as a pus taps. For this draining of the pus, an incision is placed in the third or the fourth web space. You can see here, as we have seen, the web spaces, which is a subcutaneous space within the fold of skin and connecting bases of the proximal phalanx. In the simple word, I can say a space between the two fingers or in between the thumb and the index finger. So these are the web spaces. This incision can be taken for the draining of the pus. Each vespers has a free margin and this web space extends from its free margin up to the level of the metacarpophalangeal joint.